sedation is a technique that I use in my office to help modify a child's behavior. Now, sometimes we see kids that are very young or very apprehensive and have significant treatment needs where they have maybe lots of cavities that they need to have filled. Oftentimes we'll see very young children or children who have lots of dental needs that are otherwise not able to sit for that amount of time to get those cavities cleaned out, and so I'll recommend a sedation. And the sedation is, and the way that I do a sedation is I will do an exam on the patient to make sure that they're healthy enough in our office and that we can minimize any sort of risk that would be associated. And we'll check the patient out in the morning and give them a little drink, a little medicine that we give the child to relax them a little bit. The goal is that the patient is in what's considered a moderate level of sedation, where they'll be awake the whole time, breathing on their own. I'll be monitoring them with our monitoring system. And they'll just be a little more relaxed, a little more calm. I've heard it described as kind of a twilight or just a state in where the child is a little more relaxed in our office, so we can do the normal treatment that we need to do, which would include any other treatment. Sedation is very safe. Sedation is safe when the proper precautions are taken, and when the proper person is trained in sedation and in any sort of emergencies, any medical emergency that may arise. My team is well trained in any sort of emergencies. As part of my residency training, we do a lot of sedations, and we learn how to manage them and when it is appropriate to recommend a sedation. It's a good concern. It's a valid concern. Anytime that you're altering the mental status of a patient, there is some risk that's involved, but we do our best, and I do my very best to check the patient's medical history and make sure that they are otherwise safe to treat in our office. Most of the kids are a little drowsy after sedation. They'll be a little bit sleepy. A lot of kids will go home and they'll rest for the rest of the morning after a sedation appointment. IV sedation, here in my office, I have a trained anesthesiologist who comes in and once or twice a month. Sometimes a very young child or a child with lots of dental needs would require IV anesthesia. IV sedation is reserved for patients with lots of dental treatment needs and those who are very young and unable to cooperate in our office. Sometimes a conscious sedation may not be sufficient to help a patient relax in our office, and I would recommend at that point that we do an IV sedation in which I have an anesthesiologist who's trained to do pediatric anesthesia come into our office, and that anesthesiologist will have those patients go to sleep, and she will monitor them the whole time. And myself as the dentist, I will focus on just doing the dental work.